Uh, So tell me about some phone skills tactics that you use that work really well. Let's share. So let's see who we got in the room. We got Sarah from St. Louis, and we've got Sophia. And where are you, Sophia?
From Alaska.
Alaska. Yeah. Yeah. And then we've got, is it, what? I'm sorry, Stephanie, right? Stephanie?
Yes.
And you're in New Jersey somewhere, maybe?
Yeah, Medford, New Jersey.
Yeah, that's right. And then we've got Jenny and Rebecca from Kentucky, and I see Melinda is on here as well.
Melinda and Christy.
Yeah. Melinda and Christy, that's right. That's right. Okay, trying to keep everybody straight. And you guys are in California, is that right?
Yes, we're in California.
Dr. Yamoto, yeah.
Dr. Yamoto.
All right, very good. I've known him for a long, long time.
He's a great doctor.
He is. He's a wonderful person. So share with us some excellent phone skills tips that you've learned over the years, like maybe about the insurance question. How do you answer it?
When somebody asks us if we have insurance at Dr. Yamoto's office, we say that we could bill any insurance that they'd like to provide us the information to, and we can look into that for them and let them know their benefits when they're at the appointment, and we give them a treatment cost estimate. All that will be gone over on the day of the initial visit. So they usually, other than an HMO, we can bill it.
Yeah.
So we just let them know that if it's an HMO, unfortunately, that particular plan that was purchased by their employer requires them to go to a specific clinical setting, clinical doctor, or we'll tell them it's a particular doctor that's on a list. It's a different type of insurance. So unfortunately, we can't bill that one for you, but you're welcome to be a patient in our office if you'd like to do it on a cash basis.
Yeah, I would say, we would love to see you. We'd be happy to see you.
Yeah.
And you can certainly come here, and we have a membership program in our office. And, that just means that your insurance company may not pay, but we would love to have you.
Yes.
So I think those are great tools. Thank you for that. Anybody else have anything that you say? Sophia, what do you say?
I also like to answer all of their questions with yes. So
yes, good.
yes, we take their insurance. There is, because we're not a Medicaid office, there is that one, time that they call and they ask if we take Medicaid, and I don't like to make them feel, any type of way because they have Medicaid. So
Sure.
I let them know that we don't have a contract with the state in order to bill that insurance. But if they wanted to pay cash for their appointment, we would be happy to have them.
So here, let's turn in the manual over to page 81. Let's see if we can get over there. And I just want to show you what I'm going for here, because this is really good. And you're welcoming people even though you're not in network with them. And I guess where I'm looking is really page 82 or 83. So right here, it says, keep it positive. Don't put the no first. Okay. So we want to avoid saying, no, we're not in that plan, but you can still come here. We want to say something like, many of our patients choose to come here, even though we may not be on their list. So it's following that law of the herd that Eric was talking about. We have a lot of patients with Medicare, and they choose to come here, even though we're not in contract with them. So I'm putting the yes, you can come here, like you were saying, yes first. And then at the same time, I'm letting them know that we're not on the list. Does that make sense?
Yeah.
So that's really important. And I've had patients, even though they were on Medicare, choose to come to us because they felt welcomed and they felt a connection on that phone call, because we're treating them like a human being. Some of these Medicaid patients feel like, they feel insulted on the phone.
Mm-hmm.
So that's really good. Okay. Anybody else have anything you want to share on your phone skills?
Here we are.
I think
There we are. We found ourselves.
I think more of like how you say things, like the tone in your voice and how you approach every, patient differently. Because we are such a small practice, there's only one doctor, there's one permanent hygienist, there's one assistant, and then there's me. A lot of people, when they do call, their first question is, what kind of insurance do you accept? So that's always something that, I have to approach on a daily basis,
Yes.
because we are such a small practice, we are only in network with one particular insurance, but we do accept all kinds as long as it's a PPO.
So
So
we
just
wanna
trying to
flip-
get, I guess,
we just want to flip that and put, we accept all
Right.
kinds of insurance. We're happy to file that for you. We have lots of patients who come here, even though we're out of network.
right.
And it goes back to the form. Remember when Eric had the form up, which is in the manual at the very end. I'll go back to that. So we go to the end of the manual right here. A lot of times when they ask us that question, do you take my insurance? We feel like we have to answer that immediately. You know where we want to answer that? We want to answer that way down here.
Yeah.
So the thing to remember is when they say that, go into getting their name, just like Eric did. He demonstrated that so well. I'm so glad you asked that. I'd be happy to help you with that. And my name is Paula, and yours is. And when was the last time you saw it? Oh, you're a new patient. That's awesome. So how did you hear about us? I'm keeping my I personality up, and I'm enthusiastic. Well, how long has it been since you've seen a dentist? 5 years. Wow, that's a long time. Is there a reason? Was there anything that made you feel uncomfortable? So now I'm down here in the SWAT. I'm finding about their dental experiences, and then I might get to the place where, when you first called, you asked if we accept your insurance. Well, I'd love to go back and help you with that. You see what I've done now? I've postponed my answer. Is that what you guys try to do?
We had, I tried to find out how they were referred to us. And a lot of times we have a really good, like, in office. I mean, a lot of our patients are referred just by other patients. And so if I can find out where they're referred by, they work with so-and-so, we can really talk about that. And then when it gets to insurance and I say, oh, well, we always do a complimentary benefits check
Oh, I like that.
before they come in the office, just so there's no surprises. I always wait till the very end to get to that. So if I'm talking to so-and-so, they were referred by so-and-so, they work together. And then I say, this is your insurance. We do submit to it. There is a difference between in and out of network, just so they know ahead of time.
Yeah.
So, I just had a family schedule yesterday, a family of 3, and there's like a 50% in network, out of network difference.
Wow.
Because we built that relationship. She already had a good idea of our office. And so I was just really excited about that because, that is a big difference for somebody.
It sure is. Absolutely. Great job, Sarah. And so what she's talking about, page 83 at the complementary benefits analysis. And there's some other questions you can say of like, are you free to choose any dentist, or are you forced to go to someone on a list? Those free and forced words, those are teaching questions. And nobody wants to be forced to go somewhere. They want choices. They want to be free. So you can say, I tell you what, we'll be happy to do a complimentary benefits analysis for you. And even if you already know what their insurance does, just saying, let me do that for you and I'll call you back or whatever, makes them feel good that you're doing that.
And when you use that free and forced, and then you come back and talk about that with them as a doctor and why they don't participate, then they're like, oh, I get it. They don't want to be forced to wham, bam, thank you, ma'am.
Yeah.
Kind of like plants the seed for them.
Good point, Sarah. That's a really good point. That translates into their treatment as well. Only what the insurance will cover,
Yeah.
You're talking that way.
that absolutely does. There's another page in the manual. Let me share my screen again. You got this going on. You can tell you've been doing this for a while, Sarah.
Oh,
So look in your manual. We're in this insurance section. It's actually the next page. That why are we not in network? You know, so on page 87, there's a question right here. Number 7, that says, Ms. Smith, have you heard all the talk about health insurance in the news? Well, many things are changing, including dental plans. Premiums are going higher, benefits are going lower. Did you know that a lot of our patients are losing money on their dental plan? And here's a list of some things that we have been seeing that have changed, that the insurance companies have downgraded their plans. Because, you know, the patient doesn't want to hear that the insurance company's not paying you enough, do they?
No.
They think, hey, the doctor's rich, he could take a cut for me, right?
Yeah.
And so when you start sharing with them these things that are downgrades in their benefits, that can make a difference. That's a really good point. That's a really good point of why we're not network. What's in it for the patient? Good stuff. Good stuff. Okay, so let's shift over to team harmony and appreciation. What do you guys do? I'm anxious to hear what you guys do to celebrate your team and how you keep everybody feeling appreciated. You got some ideas?
Our doctor is really kind to us. As you know, Dr. Yamato, he's a very kind, generous person in general. And he always puts the team first. It's always about the team prior to patients or whatnot. He wants to make sure the team's cohesive, the team's happy, things are working for the team. He takes us on a lot of outings where every 3 months we do something together as a team. And then things like your 5-year anniversary, every 5 years, you get to pick a venue and you get to pick where you want to go. And all of our husbands are incorporated into it.
Oh, nice.
Which is really cool. And so he's very much about, like, he loves everybody's husbands. He loves everybody in the practice. He calls us a family. So it's not just about an employment, it's about being part of a family.
Oh, that's sweet.
Why I think there's been such longevity in the practice, because the person that Christy just replaced was there 34 years. Our hygienist just retired at 20 years and now is moving to North Carolina. And our assistant left us after 8 years because she's in the nursing program. So we always laugh because I got in because somebody retired. And she got in because she knows. No, I'm just kidding. It wasn't because she knows. She's my sister. She's my sister. I don't know. She's my real sister. That's why Eric was teasing us at the beginning, because she actually came in to help when our receptionist scheduling her had to have a procedure done, a medical procedure done, and she was only going to be out 6 weeks. But then she decided, oh, I like this. I'm not coming back. And so Christy did such a great job in helping us, and she'd been in dental for a long time, and then stayed home to raise her children, and then now she's like, yeah, I can work. So
Awesome.
it kind of worked out. But it's funny because you don't really get into this practice. It's a joke unless somebody retires, and our temps and stuff come in, and we're very supportive of each other as a team. We try to respect each other. We try to hear each other out, and if something's going wrong, we try to stop and say what's going on and how can we be of a help to you to make this situation and you feel better. What do you need for the support? Good. So we try to support each other to the best that we can, and be appreciative of each other, and understand that, you know, each of us do a different job, and
thanks.
Are an integral part. And we have weekly meetings and morning moms and all that.
That's awesome. Yeah, that's really awesome.
Yeah, and at night when we all go home, every person says goodbye to each individual on an individual basis.
Oh,
it's nice, because you
how
feel
special is that?
You feel cared. You feel like you actually care. So it's nice because it helps. You see that your team cares about each other. So those are some of the things we do.
That's really, you know, you painted a great picture of the atmosphere, the culture there, right? So what
We
is
even eat lunch together.
Oh yeah, boy,
Yeah.
some teams are like, no way, I'm not eating with him.
Yeah, peace out. Yeah, no.
Yeah. Jenny and Rebecca, what do you guys do? I know you have a fun atmosphere. Y'all have made some awesome videos, by the way. I just think that's a great way to have fun as a team.
Well, I think actually we've been struggling with that, especially in the past year. There's been a lot of new people come because our practice has grown.
Yes.
And just the harmony in our office is just kind of off right now, to be quite honest. We've got ages ranging from people in their 20s all the way up to, well, Dr. Pope turns 60 next week, so he's the oldest one. And I don't know if that's the age difference and maybe kind of work ethic. We've just been really struggling with a whole lot of that. And then, of course, within the last month, we've changed over to
The new software.
new software and just getting people on board with that. It's been a struggle. And you would think that it's the older, the older ones that are not you, not you. Dr. Pope.
Speak for yourself.
No, Dr. Pope is just barely ahead of me. So just so you know. I am not talking about her at all. I have been alone in this office for a long time.
Yeah.
She's my rock, I'm telling you.
Yeah, right.
But you would think that, the older ones would have a harder time with the change, but it's actually the younger ones that we're having a hard time getting.
Yeah.
on board with
I think I might have even mentioned this to Dr. Ruby on Wednesday morning when we had a call. I said, I always tell teams when they're changing software to get an old monitor, put it in the backyard and get a baseball bat and let people go out there and beat up on that.
Yeah.
Because it's such a stressful time. And that's also when we can bring food into the office, like chocolate, feel-good foods, apple pie, homemade bread, popcorn.
Yeah.
Who else has been through a software change? How'd you get through it?
We have.
Well, when we did ours years ago, we went paperless back in 2013, I think it was. It's always a change because everybody's used to writing stuff. And they still fight it to this day sometimes. And you just have to kind of reassure people that we're all in this together, and I hear what you're saying, and how can I help you get through that? What do you need support-wise? We did it by, instead of like just doing every chart, we did it by when patients came in. And then, we, in the front office, we were responsible for putting in charts into the even today, we still put papers that come into the file, the document servers, and then we make notes on the appointments, patient MX history, HX here. And then that way the hygienists know, okay, there's a new medical history. I'm going to go in the document center and it's going to be there. It's just finding shortcut ways to support each other so that they have a way of finding the information without feeling the struggle. Because I find that the clinical team, when it comes to the computer, they hate it, more so than the front end, because we're used to paper, and having certain things and dealing with insurance and stuff like that.
Yeah.
They need tangibility of paper. So we allow them to have printed out slips, the clinical staff.
That's a good idea.
Because then that way it supports their needs, and then they don't freak out that it's just in the computer, and then it's their responsibility to shred them when they're done with them. And then they can make notes on them, do whatever they need to do to support themselves during their appointment while they're in their room with the patient. So we just try to help them out a little bit.
Yeah, that's a really good, we've got maybe 3 more minutes left. Anybody else have ideas? That's really good, Melinda. Thank you for sharing that. I had to have my paper too for a while. It took me a while. That was my crutch.
Yeah, I love it.
that was okay.
Like I said, we have the ones that are in their 20s that all they use is electronic, and then we have 40s, 50s, 60s that are paper, and some that use paper and computer, so you can see our charts are all still back. Yeah, you can see all of our charts still back. They're all still back here.
They'll be on the same plan.
Yeah.
All right, good deal. So let's see how much time we have left here. Yeah, 3 minutes. Okay, we're good. So anybody else have an idea on helping? I think the one-on-ones really, Rebecca, are a great idea to just have everybody go through that, do a round robin, and then just start some appreciate notes. Grab a pack of sticky notes and just give everybody a pack of sticky notes in the morning huddle, or unless you want to buy some or make some, print out some.
I just bought them on Amazon.
What's that?
I just found some on Amazon and bought them.
Yeah, good. And just pass those out at huddle and say, okay, give everybody like 5 in morning huddle and say, I want you to use these by the end of the day. And make sure you catch somebody. Some people call it caught in the act. And it just lifts the morale, just being acknowledged. And everybody's struggling, everybody's doing the best they can. But just a quick little word of like, hey, that was great, or doesn't have to be a long, drawn out thing, just a little note with a heart on it, or just something fast and easy, and give everybody 5. You got to use all 5 of these by the end of the day. What do you think? Could you try that, you think?
Mm-hmm.
I think since COVID, in our
Yes.
office, our hygienists are burned out.
Yes.
Doctors giving them each an hour twice a week for catch-up time to try and
Just decompress.
just to decompress. They're saying because of all the calculus and buildup on the teeth, and they're not having enough time to get everything they need to get done, and then they still have to do their notes, and
Yeah.
they're late every day. So they've been feeling unappreciated, neglected a little bit. So we've been really working really hard. It puts a lot of pressure on us in the front to have to try and move patients, which is really hard because everybody wants in now that California is opening up again. It's more patient flow than I've ever seen in any office in my career.
Yeah.
Isn't that way for everybody, right?
Was that okay, Paula?
Hey.
All right.
Okay.
I'm gonna go to room 2.
Okay. All right. Very good. Bye. Okay. Hi, guys. Well, that was abrupt.